Good afternoon and welcome to United TV. It's our Bariatric Friday today at 3 p.m. Dr. Irgau is our guest, and we are gonna, as usual, we are gonna tackle critical topics on those who are considering undergoing bariatric surgery. Today, we are gonna explore the impact of smoking and alcohol use before and after bariatric surgery, from the increased surgical risks and potential complications during the recovery. This is a really important issue, and we want our patients to have the proper education before they actually go through the surgery. So Dr. Irgau, as usual, is going to help you with elaborating this topic on the clinical side, and we are going to start now. How are you doing, Dr. Irgau?
I'm doing great, Kemal. How are you?
Good, very good.
Excellent.
So smoking and alcohol, we can actually maybe start with smoking first. Before and after, pre, post surgery, based on the different type of bariatric surgeries patient may be getting, how the risk actually changes or it doesn't change. If you can give us the overall on the smoking for those who are considering bariatric surgery.
Absolutely. Thank you, Kemal. This is a topic that we've obviously touched upon in the past, but we cannot really give too much education on this issue, really. They are very important. They touch upon issues that come up as questions by patients very often, but they're also critically important in their impact on the health of the patient, but also on the outcome, particularly long-term outcome of bariatric surgery or potential complications. Smoking, obviously, a very important issue, right? Smoking is bad, period, right? There is no question about a little, moderate, or too much. We just say smoking in general is a bad thing for anyone's health. But there are particularly pertinent risks when it comes to bariatric surgery, before and after bariatric surgery. Before bariatric surgery, obviously, we're very, very concerned about potentially increased frequency of complications of the actual surgery if the person is currently a smoker when they undergo bariatric surgery. So it is no surprise that our program and similarly many other programs that are certified as centers of excellence actually have a requirement for the smoking cessation prior to bariatric surgery. And why is this important? Well, there are certain complications of anesthesia that are greatly increased if a person is a smoker. One of them would be respiratory problems, right? Inability to get off the breathing machine after anesthesia, the likelihood of having increased risks of pneumonia after surgery, the likelihood of having complications related to healing because of smoking, right? Because smoking does affect blood flow in several tissues in our body, and blood flow integrity is critical for healing of our tissues. So therefore, if a person is an ongoing smoker at the time of surgery, obviously those risks would be increased, right? So we have a great deal of interest in preventing complications of bariatric surgery, right? We know complications can happen, and we know also the best way to take care of complications really is preventing them in the first place whenever possible. And we can prevent those complications if a person is a smoker. So every time we see someone in consultation prior to bariatric surgery, one of the questions obviously is if they are a smoker. And if they are, obviously we inform them that they have to start working immediately with the intention to quit smoking at least 4, if not 6 weeks prior to bariatric surgery. And very often, this could be patients who have had or been smoking for many years, if not for a lifetime, right? And also, it is critically important for them to understand that it's not going to be easy to stop smoking. In fact, these patients will probably have tried to stop smoking many times prior to that, and then obviously not having been successful. So we understand how difficult this task is, and that's why we talk about it, head on at the beginning and present this to the patients as probably their most challenging task as they prepare for surgery. But I also show them the uptake. I show them the upside of this. And that is not only they're really decreasing the risks of complications that could happen, with bariatric surgery, but also they are freeing themselves from this huge health hazard that is going to be, a problem for them, not just because of bariatric surgery, but because of all the other major risks of health related to smoking, which is cardiovascular risk, which is risks of lung cancer, obviously. And, what better outcome to have of a patient who struggle with obesity as well as smoking, for them to come out of bariatric surgery now losing weight as well as not being a smoker at all. This is a fantastic outcome whenever it can be achieved. So when patients are presented with these potential rewards, they will put the effort. And then, of course, it's not just a question of go home and stop smoking. There are many helps that patients can get now from their primary care doctor or other sources to help them quit smoking. So we really put a lot of emphasis on this. And as I said, it is a hard stop for us. It's a red line for us. If the patient continues to smoke, we would have to postpone the surgery until the time comes when they completely stop smoking.
So typically, we want them to stop smoking at least 1 month. If it's
longer, if possible, but 1 month would be the shortest.
And how do we actually support for the process of stop smoking?
So as I said, it's all about education, right? Obviously, you could say, well, they've heard the benefits of stopping smoking. They've heard the benefits of quitting smoking before. How is this going to be any different? Well, because they're also undertaking a major procedure now to change the trajectory of their health, right? Both obesity and smoking are serious threats to their life, right? In one go, they would be able to take care of both, right? So with this realization can come also the energy, the positivity that can come to really give them the drive to stop smoking. As I said, it should not just be that drive, but also we have to provide them with tools that will make them more successful. As I say, very often, many primary care physician offices, including United Medical primary care offices, actually have programs for smoking cessation that not only look into medications, but also the ongoing social support that is needed for them to be successful.
So now if we go to the alcohol, I think that's maybe a little bit more, is this problematic? But it's...
Can I touch upon a couple of things on smoking before we go to the alcohol? So there is another issue that we have to consider, right? And that is, can patients go back to smoking after bariatric surgery? Is it okay for them to do so? And the answer to that is absolutely no, right? So it's not just a question you have to stop smoking to get the bariatric surgery done without complication. It also, you have to be a non-smoker for you to really not have complications related directly to the smoking after bariatric surgery, particularly in procedures like gastric bypass or the sleeve gastrectomy, where we've made some major changes to the upper portion of the digestive tract. If a patient continues to smoke or resumes smoking afterwards, they can put the healing of the surgery in serious jeopardy. For instance, with gastric bypass, we create a new connection between the intestine and the small stomach. That's called an anastomosis. It's a surgically created connection between two portions of the digestive tract. That connection is vulnerable to something called ulcer formation, which is almost like a wound that can occur there. Now, if that occurs, not only can make the person's life miserable because it is really painful, but also the ulcer itself can cause life-threatening problems like bursting or bleeding, serious internal bleeding. Now, these complications are much more likely to happen if a person is a smoker. So we say whenever you're considering having gastric bypass, you have to take smoking completely out of the equation. It should be something that you never touch upon because those problems are real. And if an ulcer occurs in this connection that I mentioned, the chances of healing that ulcer with medications are almost zero if the person is an ongoing smoker. So stopping smoking is critically important. Similarly with the sleep, if the person is a smoker, they can worsen heartburn if it occurs. They can restart heartburn if it was not there, but also they can damage the lining of the stomach and cause problems there as well. So, needless to say, stopping smoking before bariatric surgery, critically important to avoid complications of the surgery itself, and then quitting for life afterwards as well, so that complications do not arise afterwards, even years after bariatric surgery, if the person resumes and they pick up smoking again.
Sure. And obviously, from the clinical standpoint, we'll never tell anyone that smoking would be okay, right? So even if they don't go through the bariatric surgery, but of course, with our patient population, that's a bigger problem than ever. Now, can we go to the alcohol?
Of course, yes. That's the other.
So, well, alcohol probably is like unlike smoking. Alcohol probably has a lot of contribution to the morbid obesity before the surgery. So, and then also after the surgery, there are issues that we are going to discuss that actually makes things more complicated. Not necessarily maybe just right away after the surgery. There's, the complications long term is different in terms of weight gain and others. So if we can kind of give the overview on alcohol first.
Absolutely. So there are important considerations about alcohol intake after bariatric surgery, because the changes that we make in the digestive tract actually changes the way our body processes, the way it metabolizes, the way it absorbs. Okay? So if you take a procedure like gastric bypass, for instance, where the larger stomach, the big stomach that receives food immediately from the food pipe now has been reduced to a tiny little egg-sized stomach that is directly connected to the intestine, which absorbs nutrients immediately. It means that whenever a person drinks alcohol, that alcohol doesn't have a buffer like it did before in the big stomach. It will go into the intestine immediately, which means that it will go into the bloodstream and enter our system much more quickly, particularly the first area where the substances that are digested and absorbed by our intestine go is the liver. So the liver will receive them immediately, right? But because of the absence of that buffering of the stomach, as I said, and because of the rapid absorption of this alcohol that comes in, the alcohol level in the blood tends to go up very quickly after bariatric surgery. It tends to stay up much longer. And the chances for the person to become intoxicated are much higher, even with a small amount, right? So this is the immediate picture, which means that if a person, for instance, had a glass of wine before bariatric surgery and they felt fine, meaning that they didn't feel really intoxicated and they were able to function well, that single glass of wine after bariatric surgery could mimic almost 2-3 times that amount, meaning that the person now will become intoxicated much more quickly. They will stay intoxicated much longer, right? Which means that it could obviously cause a lot of problems, whether they're going to be driving and doing other things as well, right? Now, the other problem, obviously, we have to see here is that if a person becomes intoxicated, right, they are not going to be in their usual judgment frame of mind, right? So their judgment will be affected as well, which means that the things they're not supposed to be doing after bariatric surgery, now they may not be inhibited anymore, and they could do things, right? So a lot of problems can occur if a person resumes drinking too much after bariatric surgery because of the changes that I mentioned, right? Now, there is another problem, which is a real problem. And that is the risk of becoming dependent, alcohol dependent, would be higher after bariatric surgery also, right? And that's a real problem. Now, why is that? Well, because one of the things patients struggle with before bariatric surgery is they have almost this dependency on food intake, utilizing food as a way to deal with emotional problems or with stressors, right? Eating when you're not hungry, but because you want that rush of sugar to make you feel better because you don't like a stressful situation or emotional burden, right? Well, food may not be available after bariatric surgery because the amount of food they can consume is limited, right? So it is easy to slip into something else that may make you feel better momentarily. And alcohol is way more dangerous from that point of view because the chances of becoming dependent on alcohol are much higher when you're using alcohol for those purposes. So alcohol dependency is a real problem. It's a real problem not only because alcohol dependency is a bad thing by itself, Kemal, but because a person who's had bariatric surgery and they become alcohol dependent, their chances of getting liver failure are much, much higher because it takes much less alcohol level to ruin their liver, to get their liver destroyed than it would be before bariatric surgery.
Dr. Ergau, the way that I would like to kind of start, starting from smoking and pre and post impacts of smoking and why this is a risk factor for those who are going through the, well, it's a risk factor for everyone, but for those who are going through the surgery, it's a bigger risk factor. If we can talk about the complications with pre and post surgery, if they are smoking, then we'll just go to the next questions.
Right. It should be a fairly straightforward topic, right? Smoking is bad, period, right, Kemal? But it is really, really bad in the setting of bariatric surgery. And that's why we emphasize greatly about the need to quit smoking before bariatric surgery. And the reason we want people to quit smoking even before bariatric surgery is not just necessarily because it is important for them to stay quit after surgery, and we'll talk about the after surgery issues, but really for them to go through the surgery safely. It's important that they prepare themselves in the best possible way. And if they are smokers, by far one of the best things they can do to reduce the risk of potential complications of bariatric surgery, Kemal, is to quit smoking, right? And we tell them to quit smoking at least 4 weeks before surgery, if not before, right? And why is that? Well, because there are very well-known complications that go along with people who are continuously smoking and they undergo anesthesia, whether this is pneumonia, whether this is cardiovascular problems or blood clot formation. These are potentially serious and life-threatening complications that can be completely avoided with smoking. So there is really no issue here. In fact, as you know, in our program, we would not proceed with surgery unless the person has quit smoking completely, because really the risks that the person is undertaking by continuously smoking is just not worth for the patient, and we feel very strongly about that. And of course, bariatric surgery is a necessary surgery, but it's not emergency surgery, which means that we do have time to prepare. And if the patient has really struggled and they're not ready yet, well, we wait. And it's not that we just send them out and say, "Oh, you have to stop smoking." Stopping smoking is one of the most difficult things anybody can do. And we tell patients that, openly. And of course, most patients know that as well, because for the vast majority of patients, the understanding that smoking is bad for them is inherently known by now. And of course, they will have tried many times but failed. But it is interesting that by the time they come to realize that bariatric surgery is important for their life, it's almost like they come to an epiphany, Kemal, saying, like, this has got to be the reason for me to stop. And the vast majority of our patients actually end up stopping smoking. And it's wonderful to see somebody not only getting healthy by losing weight, but having stopped smoking as well. It's really a wonderful, wonderful outcome. And patients who have stopped smoking after years of smoking and patients who lose weight after bariatric surgery are just a delight to see post-operatively, because they become healthy in every way, obviously, because of what they've accomplished. So stopping smoking before surgery is very important, and it's also mandatory in our practice. And as I said, we don't just say to patients, go stop smoking. We do provide help as well. This help comes in terms of counseling. There is a wonderful smoking cessation, pathway that we have through our United Medical program. And obviously, we ask for their primary care doctors to help us as well, either by providing medications or counseling, so that they can do it. And the other important thing is that there is time for them, right? Because when we see them for consultation for bariatric surgery, once we counsel them about the importance of stopping smoking, the whole process of preparation for bariatric surgery takes several weeks, if not months. And so they will have time to really adjust and stop as well. So preventing complications related to the actual surgery, to the anesthesia, is important. But how about staying quit afterwards? Why is it important for people, for instance, not to resume smoking afterwards? Well, there are important reasons, because smoking happens to be very, very bad in terms of complications it creates after bariatric surgery, particularly people who've had gastric bypass, for instance, Kamal, they can develop ulcers at the connection between the stomach and the intestine. It's called the anastomosis. It's the new connection that we make to construct the gastric bypass anatomy. And that connection is very vulnerable to formation of an ulcer. An ulcer is almost like a wound where the lining, normal lining of the GI tract is lost, and there is clearly an open wound there. And that open wound cannot heal if the person is continuing to smoke. And if it doesn't heal, what happens? They have continuous pain, and this pain is a nagging pain that is very difficult to get out from. Most importantly, the ulcer can burst, Kamal. If the ulcer bursts, they could have a life-threatening infection called peritonitis, or even worse, a blood vessel within the ulcer can burst, leading to massive internal bleeding, right? And that can be life-threatening as well. So these are real and present dangers that are caused by ongoing smoking after bariatric surgery. So it is very important for people to stop smoking. Of course, there are the other problems, as you know, the heart disease, lung disease, cancer that are going to come with smoking. So it makes no sense for a person to cut the risk of dying early by doing bariatric surgery and then cancel that totally by resuming smoking, essentially.
So if you can, sometimes when I have struggles with different terms in medicine, you kind of break those down, and you are one of those people who have a lot of patience. Like, you don't rush and you explain and after I listen to you, I really 97% of the time I have 100% understanding. So how is smoking affecting my stomach? Like, because I thought it was going to affect the lungs, right? Patients are, saying that. So what's that connection, if you can just break that down?
So it's simple, Kamal. When people inhale the smoke does not just go into their lungs, it's swallowed as well. And the smoke itself is full of noxious chemicals that just are irritant to the delicate surface of our gastrointestinal tract, right? It is actually a very, very delicate surface, and that surface can be irritated by these chemicals very easily. Now, why is it so much more pertinent after bariatric surgery? You could say, why is that not the case, for instance, for a normal stomach, right? Well, because particularly when we connect the intestine to the stomach surgically, that is an unnatural connection. That's a surgeon-created connection, natural connection. And by itself, that connection is vulnerable to creating those wounds that don't heal. They're called ulcers. So we call this anastomosis, this connection, ulcerogenic, which means it's prone to create ulcers. Now, granted, these ulcers can happen even in somebody who's not smoking. For instance, taking medications like aspirin, called non-steroidal anti-inflammatory drugs, can cause that. But the key difference is that if the person is not a smoker, Kamal, we can treat that ulcer. We can provide anti-acid medications that will lead to a complete healing of that ulcer. In other words, you do endoscopy, Kamal, you look at the surface, you see that little crater of the ulcer, the wound, the cavity of the ulcer, right? You give the person medications like anti-acid medications, let's say for 2 months. You go back and do endoscopy, and that surface will be beautifully healed. It will not be there anymore. But if the person is a smoker, you go back and look by endoscopy. Now the ulcer has become chronic. It's like a very old, scarred wound that won't heal. And those ulcers are at great risk for bursting or creating massive bleeding. And that is precisely because the person has continued to smoke. So ongoing inhalation of those noxious chemicals that are part of the smoke that we inhale if we smoke, those are what are causing the irritation that will lead to poor healing of that wound, of course.
So that is pretty straightforward, I guess. So I think
Absolutely.
people should really understand this is not just the smoking here and here. It goes into the stomach, it's impacting the stomach, and we make modifications there. And recovery is the most important thing, and especially recovery. And what you don't, let me actually just share something. So I'm going through a small problem these days, and to see the progress, Dr. Erkan, I won't go into details, but it takes several days, and in some cases several weeks, even without the operation. So I'm going through that right now, and it's on the right direction, it's healing, but it's not gone. So what we know is, and I'm not talking about the surgery specifically, but just the problem that we have in our body. So the process is a slow process, and we don't want to not only slow down that process, we don't want to complicate that process.
Right.
This is that simple. So if I knew that, let's say if I was a smoker, and if I knew that my problem today, which is not a major problem, could be disappeared in 3 days, versus if I'm smoking, it's going to be several weeks, I would stop smoking right away. So this is, that's why I'm saying that it's pretty straightforward from that point. So, and then, as you mentioned earlier, we have our care managers, care coordinators who are nurses who handle the smoking cessation, and we are here to give that extra support for them. But the thing is, you won't go through the surgery unless you quit smoking. So this is why patient needs to really understand it's an important factor. Because, just think about how much work we do to make the recovery better, less painful, less nausea, and less all those things. And boom, you are sabotaging the process with a couple of stupid cigarettes. So that's just like, you don't want to do that to yourself. So should we go to the alcohol and
so another important topic. Yeah.
So I'm drinking water. It looks a little bit dirty, but there's nothing in it. It's just, it's from here to here. So then it looks better. Mom actually says, don't drink it from this when you are live. Okay, so here we have. But drinking is another problem. Of course, not drinking water, but drinking alcohol. This is another risk factors and complication reasons. So what's the background on drinking and bariatric surgery?
So again, it has to do with the fact that bariatric surgery changes the anatomy of the digestive tract, and that the consequence of that is that the processing of alcohol is different by our body, and that has real consequences, obviously. So one of simple examples, for instance, and throughout the last 20 years, we've learned a lot about the effect of alcohol and its impact after bariatric surgery. So there is something called peak blood alcohol level. In other words, if a person drinks alcohol and you measure the alcohol level in their blood, there is a peak that is going to be reached at a certain point after they drink alcohol, right? So for a normal person, normal meaning a person who has not had any bariatric surgery, they have a normal anatomy of their digestive tract. Let's say the peak blood alcohol level may be about 25 minutes, okay? For a person who's had a sleeve gastrectomy, that peak blood alcohol level time is reduced to 9 minutes. okay?
25 minutes.
For a person who's got a normal anatomy, it's 25 minutes. For a person who's had a sleeve gastrectomy, that is reduced to 9 minutes. For a person who has gastric bypass, it can be as little as 5 minutes, which means that the effect of alcohol is going to hit that person much more quickly after bariatric surgery. And the reason is straightforward, again, because the changes that we entail, either with the sleeve and more importantly with the gastric bypass, will lead to the passage of the contents of the stomach into the intestine, where things are absorbed very quickly, much more rapidly than in a person whose anatomy has not been altered. That is the key, essentially, right? So a glass of wine is maybe much more intoxicating, much more quickly to a person who has had bariatric surgery, right? So if a person before bariatric surgery, they drink a glass of wine and they say, you know what, I am fine. I don't feel bad at all. In fact, I may even be able to drive. If I am stopped, they're not going to be able to detect anything because my alcohol level is going to be low. Well, guess what? After bariatric surgery, that changes. It changes drastically. So a person who consumes 1 glass of wine now may reach a blood alcohol level, which is the level of intoxication, much more quickly. So they may not be eligible to drive based on that 1 glass, just because the alcohol becomes intoxicating much more quickly. And there is another effect. Not only it reaches their system much more quickly and the peak of alcohol is reached much more quickly, but the alcohol takes more time to leave their system compared to somebody who has not had bariatric surgery. Right? So those are real effects, right? And then the other very, very important concern that we have, Kemal, is that for a number of reasons, bariatric patients seem to be more at risk for becoming alcohol dependent if they indulge in alcohol. And there are a number of theories for that. And one of them is that if a person has struggled, for instance, with weight most of their life, and part of the adaptation has been, for instance, to deal with stress by eating, right? Now that they've had bariatric surgery, they are not able to deal with the stress by eating because we've made their stomach so small that they cannot, right? So getting to a different maladaptation to try to deal with their stress is almost much more likely, and alcohol is one of them. So not only now the effects of the alcohol immediately are much more prominent, but long-term, the alcohol issue could become a real problem for them. And that obviously is disastrous because the potential for liver failure, for instance, are much, much higher. Much lower levels of alcohol in an ongoing basis can lead to liver failure in a person who's had bariatric surgery compared to a person who has not. So what is the bottom line here? Come on, the bottom line is that we're not saying, you can never drink alcohol. We're saying there are warning signs here when you drink alcohol that should be much more prominent when you've had bariatric surgery compared to a person who has not had bariatric surgery, right? These are important points. Now, some bariatric surgeons say these risks are too many and too high. Let's have a policy where we say everybody who's had bariatric surgery should abstain from alcohol completely. And that's the viewpoint. We may not be able to realistically bring that about, Kemal, because the vast majority of post-bariatric patients are actually responsible drinkers. They get the message provided we are teaching it. And so we should not be penalizing them because of this, but we have to really be able to recognize the patients on whom this could be a problem. So, for instance, if a patient tells me that they've struggled with alcohol at some point in their life, right, Kemal, that's a red flag. I say, okay, you're off alcohol now, good for you, right? You've been dry for so many years, you've abstained, you've done extremely well, right? Now that your life is going to be transformed with weight loss surgery, where your lifestyle is going to change, right? Is the temptation going to come again? And if the temptation comes back, are you going to fall again for that? Well, the possibility is there. So for patients who've had any type of alcohol problem in the past, I absolutely tell them, don't even touch a drop afterwards. That's the best and safest policy.
So I think we really need to understand this is not about just, I always make this point in almost every other episode. It's not about just patients who are going through the surgery, but patients who are not going through the surgery, or people like us who are not going to go through, hopefully, any of the process, because we are trying to maintain what we have by limiting alcohol consumption. And that's kind of like, it's not like we are, like the patients of bariatric surgery are being the victim, because this is what we expect from everyone. So there shouldn't be any relentless, just, out of control drinking. But now knowing that your body is going to go through a big change, that's what I hear from you is, like I just saw that patient that you sent me with the BMI graph. That patient lost 120, 130 pounds. So when you lose, so let's just highlight that's not a bad thing. So we want people to lose that much weight, right?
Yeah.
But that's a new person, new body, so that everything is going to be different, and how our body is reacting to certain things, because that happens in a very short amount of time. So it's not happening in 6 years; it's happening in 6, 7 months. So therefore, we are going to see. We are not going to know how we are going to react to those. And the best thing is being knowledgeable, being aware of what this will be. Like tonight, we have a Christmas holiday party. So, and they asked me whether or not I want lunch, and I'm going to probably have late lunch just because I don't want to eat too much at the party, right? So if I have a couple glass of alcohol, I want to prep my body so that I don't get drunk or out of control with alcohol. So this is all about how we are prepping our lives, how we are prepping our own body.
Yeah. So these are essentially it, right? To understanding that your body is different after bariatric surgery, right? And then what alcohol does. So how should people go about it? What kind of guidance would I give them as a bariatric surgeon? One of the things I tell people, Kemal, is that if you've had bariatric surgery, avoid alcohol for at least 6 months. It's just keep it out, right? Don't even think about it, right? For 6 months, right? And then afterwards, if you were to introduce it, then there are some important rules. We talked about the fact of quantity, right? The amount of alcohol that could make you intoxicated before bariatric surgery now is way, way too much, really. A much smaller amount, maybe half of that, maybe a quarter of that could be intoxicating now, right? So that's important. But the other things to consider are, when you're considering an alcoholic drink, of course, you want to make sure you don't consider something that, is carbonated. So beer and things like that are out, right? Because we, as a guideline, we tell people not to have anything carbonated, right? The next thing is, if you're going to have mixed drinks, make sure you don't get something that has too much calories, too much sweets in it, right? Because those by themselves are going to increase much more the effect of the excess calorie when you're about to drink. And then, as we were mentioning earlier on, you have to be measured. It's very important because, sometimes if people get distracted and drink too much and they get intoxicated too quickly, then their sense of judgment also goes away. It's almost like a vicious cycle, right? You were very careful, right? But if it hits you too quickly, then that care is not there anymore, and you may start, doing things that may be very difficult. So that I tell people also that, if you thought that just having a glass of wine was okay to go driving, before bariatric surgery, now it's a no. Do not drink and drive after bariatric surgery again, because the effect is a lot stronger, much more impactful, but also the effect can stay there for longer. So it's really very, very dangerous from that point of view. And then, of course, I talked about the fact of, the weight regain. For patients who have had gastric bypass, they could have something called dumping syndrome, which is very, very unpleasant reaction, particularly if that alcoholic drink had too much sweet. But there are other things, Kamal. The alcohol itself can be corrosive. It can actually damage the lining of the stomach. It can lead to gastritis. It can lead to ulcer formation, and ulcer formation, particularly after gastric bypass, is something that can happen, and it can be very, very serious problem because ulcers can burst, ulcers can bleed, right? But then with excess alcohol, there is a much lower threshold for getting things like liver damage as well, right? So really, all these are important points. So people who had gastric bypass drinking excessive alcohol can end up with liver failure a lot more quickly than people who didn't have gastric bypass. So your ability to protect your liver is much less in that situation. And that would obviously be very, very devastating. And there is another area that is very important, Kamal. How about becoming alcoholic after, bariatric surgery? How about falling into a trap of alcoholism? Well, as it happens, it can happen, right? It can happen. So anybody who felt they may be vulnerable to this, before a bariatric surgery, their best point might be to just stay away completely, particularly if they were using food as a way of coping with stress. Now that they cannot do that because their stomach is too small, they can easily fall into a trap of utilizing alcohol, substituting alcohol to food, and that obviously would be devastating as well, because alcoholism by itself is a devastating condition for anyone. Now, granted, it doesn't. This is not something that can happen only to somebody who was prone to alcoholism. Anybody can become alcoholic after bariatric surgery much more quickly, obviously, because, as I said, that the amount of alcohol that are needed for somebody to become intoxicated are much smaller. But this is an area which is very, very important for people to understand. So if there is any inclination for anybody to really become vulnerable to alcoholism, their best option, best policy might be to abstain from alcohol completely. So essentially, the message I want us to give, Kamal, is that there are real dangers when you start entertaining the utilization of alcohol after bariatric surgery. It doesn't mean you cannot, but your guardrail must be up and up really high so that you protect yourself, your health, and also don't fall into a situation where you start regaining weight because you're utilizing, empty calories that come with alcohol.
So what I hear is don't sabotage your process.
Absolutely. Absolutely.
Right? Yeah. Now, let's talk about smoking. Again, from the pre and post-surgical, what's our approach on smoking?
So a very, very important topic also. I mean, one thing that you said earlier on that is really, if you think about it, is actually incredible, is that you say we don't see as many smokers, right? Well, because our society has actually moved, and I think this is probably one of the biggest triumphs really of population health, is really educating people and educating our society that smoking is really a devastating condition. So we don't see as much, but obviously we still see it. Now, for smoking, it's important to look at it definitely as pre and post bariatric surgery. Pre-bariatric surgery, as you know, the policy in our program is that you cannot have bariatric surgery if you are a persistent smoker, right? Why is that? Well, because smoking does expose you to some real potential complications that can occur at the time of surgery. And our goal is obviously the safe performance of bariatric surgery. We want people to go through bariatric surgery safely. So anything that we can do to achieve this, we will do. And one of the things we like to do is to actually make sure people are not smokers, because if you're a smoker, you can have complications related to anesthesia, whether it's pneumonia, whether it's blood clots, which are, very, very substantial problems, essentially. So we ask people at the first consultation, if they have a history of smoking, we tell them, stop. When should we stop? Well, preferably 2 months before, right, bariatric surgery. And we prepare them for quite some time because we have an extensive program. And as you know, one of the things that our bariatric coordinators check is if there is a history of smoking, they do go through the smoking cessation program, which is something that is triggered to help people stop smoking. And by and large, people actually comply with this. I'm very happy to say.